morning, everybody. It is actually a pleasure to see everybody on time. I think there are a few more stragglers who hopefully will join us soon. I think we have about 27, 28 people signed up. Just to kind of give you a brief about what we're going to do. We did a boot camp for education about a month and a half ago.
So the closest thing there was this handheld pen note system, right? And without any connectivity. So what we did was we created a system where, irrespective of where you are in the world, we wanted to design a system where you can get access to your medical records. And the primary motivation there was, say you are in an accident and you end up in a hospital. And the emergency doctor would not really know anything about you. So we created a system where you would come, sign up on our website, put all your medical information, and it's completely secured. And one interesting thing which we did was, medical records mostly are paper-based records. In fact, even today, they're mostly paper-based records. So you could actually input your paper-based records into our system without any human intervention. And in those days, fax was a very, readily available device. So all you had to do was, once you sign up, you fax all your records into the system, and we created this completely automated system where you would essentially have like a Dropbox. Today Dropbox is very famous, but in those days we were kind of the pioneers in creating your own personal Dropbox where all your records would be in place. And irrespective of where you're traveling in the world, you could actually get access to your records even if you didn't have internet access. And the way we did that was, you would get a card. There would be a phone number on it and also a personal ID number along with a PIN. And all you had to do was go to a fax machine, dial that number and your codes, and you would get a fax back. And all this was automated. So this actually saved a whole lot of retesting that used to happen in US. And it turned out that, say if you are a patient and end up into an emergency room, the cost for the insurance companies would be about $5,000 per visit, because they would do a battery of tests on you, tests which you probably did not need, including like drug interactions or all kinds of things. So our system, by providing information at the right time, actually saved insurance companies a lot. So it turned out that Blue Cross Blue Shield system was our biggest customer. And well, long story short, we did fairly well, and we got acquired by a company called Executive Health Group, and that happened around 2003. So that's kind of to just give you a background of in healthcare. There is a whole lot of opportunities in healthcare. This whole, the medical records itself is a huge problem to be solved. And, the whole electronic medical record, even today, there are multiple companies trying to, crack that code. And it is not an easy thing. And since it is not an easy thing, there's a lot more opportunity. And like that, I'm sure you'll hear a lot more stories today. And your own stories will be very interesting to hear. So without much ado, I'd ask Murli to take care of the day's proceedings. And I should tell you that, in order to put an event like this, without the help of our charter members and their active participation, this will not be happening. And I would like to make special mention of Murli here, who has volunteered to make this day happen. And thank you, Murli. Thank you so much. And over to you.